Hi everyone, how you doing? My name is Cynthia, your host of the Kettle Black Talk Show. Today we're going to be talking about breast cancer as it pertains to Black women. Just recently, I had got my mammogram done and I was nervous. I was afraid, fearful, like most of us women are when we're getting that yearly exam. However, I was a little bit more nervous because the time between my previous screening, there was some time. I was one of those people where the pandemic prevented me from scheduling my yearly exam right on the dot. I'm not going to do that anymore. I'm a grown woman. I'm too old to cause myself all of this stress and drama. So it's best to think about preventive care and to catch anything earlier rather than later. That being said, instead of talking about what I know about breast cancer and what we all know, I think we'll just go to the sources. We'll watch this real quick video and then we'll go to some actual data. Okay, here we go.
All new at 5, about 1 in 8 women will be diagnosed with breast cancer in their lifetime. And African-American women are more likely to die of breast cancer than white women.
ABC Action News in-depth reporter Anthony Hill is uncovering why this disparity exists and what's being done to save more Black women's lives.
We don't all experience breast cancer the same way.
Breast cancer is the leading cause of cancer death among Black women. According to the American Cancer Society, African-American women are 40% more likely to die of breast cancer than white women and twice as likely to die if they're over 50.
And this is a huge public health issue.
And I was devastated because no one wants to hear cancer. Because when you hear that, you always think death. I was diagnosed in May of 2007.
Tiffany Lott is a breast cancer survivor.
I found it by a self-examination.
She was just 38 years old with 2 young children when she was diagnosed. Though she had to go through several rounds of chemo and radiation, she says her faith and her family got her through.
My husband was absolutely wonderful. I had a very good circle. My mom was there for me, my grandmother, my sister, my brother. So everyone was very positive.
Dr. Monique Gary with Novartis, a pharmaceutical company, says Black women are more likely to be diagnosed at a later stage.
Our access and utilization of screening is differential in different areas, in rural areas, in areas with lower socioeconomic status. There is less uptake of annual screening.
And she says the pandemic has exacerbated these disparities. That's why Novartis launched the More Than Just Words initiative to not just bring awareness about the disparities that exist in breast cancer for Black women, but to do something about them.
We can say a lot. We can put words on the internet, but how do we reach people and impact those lives and measure that influence?
In order to do that, they're focusing on 3 things: highlighting stories and narratives from Black women to Black doctors, providing informational toolkits so Black women know exactly what to ask their doctors, and doctors know how to provide the best care for Black women, and increasing health literacy.
And we're going to really try to demystify what cancer care looks like and what breast health and preventive screening looks like.
They're even teaming up with famous people to get the message out there, like Grammy-nominated singer Jasmine Sullivan.
I wanted to be her strength. For so long, she was my strength, and
she's sharing her lived experience with her family and her advocacy and her influence in the community.
Dr. Khatam Solomon with the Moffitt Cancer Center. Thanks for joining me. When should women start to get mammograms?
Starting at age 40 and going up is usually when most women would begin routine mammographic screening.
He also says if breast cancer is in your family, you should start getting screenings at an age 10 years younger than the youngest relative to be diagnosed with breast cancer. So having that conversation with your relatives about your family health history is essential. As for Tiffany, as a breast cancer survivor, what message would you give to other Black women?
My message with you first will be your life is worth living. Early detection is fabulous. And no matter what they say to you, there's life after the diagnosis. So go through the process.
In that report, I mentioned an informational toolkit with the best ways to talk about breast cancer with your doctor so you can advocate for yourself. I think it's pretty useful, so I'm going to post a link on our website, abcactionnews.com, along with some other useful links. In Tampa, I'm in-depth reporter Anthony Hill, ABC Action News.
I think that was the perfect video to get quick information on breast cancer. Wonderful job. I'll have the information about that toolkit in the information section. Now, what I want to do is go to pubmed.gov. I tell people that the best thing to do is, instead of just, taking in all this information from sources that haven't been verified, it's best for you to do your own research and look for the sources. Now, what I did is I went to pubmed.gov and I entered in the search Black women and breast cancer. Then I went over here to filters, full text, in case I wanted more in-depth information on the article or the study, and then publication date within 5 years. Okay, what I came up with was, I'll just do the top articles. Okay, epidemiology of triple negative breast cancer. Now, excuse me, my pronunciation of some of these words are atrocious. But anyways, this right here says triple negative breast cancer accounted for 12% of breast cancers diagnosed in the U.S. from 2012 to 2016, with a 5-year survival rate 8% to 60% lower than hormone receptor positive disease. However, preventive and screening strategies remain tailored to the demographics of less lethal luminal cancers. This review examines the ethnic, genetic, and modifiable risk factors associated with triple negative breast cancer, which providers must recognize to address the societal disparities of this deadly disease. Most notable is that triple negative cancers disproportionately affect African American women and carriers of germline BRCA and PALB2 mutations. Now, when I got my 23andMe test done, I also paid for the health report. With the health report, I had taken the data from that and entered it into some of these online sites that actually give you your gene mutations, okay? MTHFR, your genetic mutations, and that includes the BRCA, etc. Now, of course, they can't look for everything, but at least you'll know that the ones that they do research on the most, that you would know whether you have it or not. And then you can make better health decisions for yourself. Now, another article that I pulled up is a validated risk prediction model for breast cancer in U.S. Black women. The purpose: breast cancer risk prediction models are used to identify high-risk women for early detection, targeted interventions, and enrollment into prevention trials. We sought to develop a risk prediction model for breast cancer in U.S. Black women suitable for use in primary care settings. They use data from Black women in 3 U.S. population-based case control studies out of 3,468 breast cancer cases. The control is between 30 to 69 years old, combined with age and race-specific incidence rates. The results: the expected observed ratio was 9%. Age-adjusted. These measures were almost identical to the model. Okay. Conclusions: discriminatory accuracy of the new model was similar to that of the most frequently used questionnaire-based breast cancer risk prediction models in white women, suggesting that effective risk stratification for Black women is now possible. This model may be especially valuable for risk stratification of young Black women who are below the ages at which breast cancer screening is typically begun. Okay, there's a little conflict of interest. Always look at the conflict of interest, this section right here. Why I'm doing this is so that, no matter what it is, the topic is, do your own research. Find, something like pubmed.gov and do your own research. Verify what you've seen in that, like that news report we just saw. Health and racial disparity in breast cancer. Breast cancer is the most common non-cutaneous malignancy and the second most lethal form of cancer among women in the U.S. It currently affects more than 1 in 10 women worldwide. The chance for a female to be diagnosed with breast cancer during her lifetime has significantly increased from 1 in 11 women in 1975 to 1 in 8 women Fortunately, the mortality rate from breast cancer has decreased in recent years, so that's a plus. Let me see. Therefore, new strategies and approaches are needed to promote breast cancer prevention, improve survival rates, reduce breast cancer mortality, for the health outcomes of race, ethnic minorities. Okay, so this is now what is this? An article. I don't know if it's a study, but let's go to the next one. Okay, call to action: breast cancer screening recommendations for Black women. African American Black women have more aggressive breast cancer subtypes, are diagnosed at younger ages, and have an increasing incidence rate. Now, let me repeat that. African American / Black women have more aggressive breast cancer in subtypes, are diagnosed at younger ages, and have an increasing incidence rate. These disparities have resulted in Black women continuing to experience the highest mortality rate from breast cancer of any U.S. racial or ethnic group. That's a problem. We've got to eliminate that. Eliminate, not reduce, eliminate. Here's the next article: hair dye and chemical straightener use and breast cancer risk in a large U.S. population of Black and white women. Now, we know, when I used, fortunately, I used a straightener on my daughters when they were younger, but I stopped after a while. And because I just didn't want to put those chemicals in my daughter's hair. Just straightforward. As they're now older, they choose to go natural. They don't want to deal with that, with straighteners, etc., and the chemicals. And that's a personal choice, so I'm not judging anyone. Breast cancer statistics of 2022 by the American Cancer Society. Breast cancer incidence rates have risen in most of the past 4 decades during the most recent data. The rate increased by 0.5% annually, largely driven by localized stage and hormone receptor positive disease. However, breast cancer mortality rates have declined steadily since their peak. So it has increased, but as far as death rates have decreased. Okay, however, despite a lower incidence rate in Black versus white women, the racial disparity in breast cancer mortality remained unwavering, with the death rate 40% higher in Black women overall and twofold higher among adult women younger than 50 years old. Damn. Black women have the lowest 5-year relative survival of any race ethnic group for every molecular subtype and stage of disease, except stage 1. Okay, I hope you got that. So early detection, preventive, and if you can, or if you're able, get genetic testing done. Okay, 6 examples of health disparities and potential solutions. Okay, examples of health disparities. Mortality, like I just, read, 40% higher mortality rate. Life expectancy, burden of disease. Causes of disparity in disease such as asthma and diabetes include systemic inequities based in race or ethnicity. For example, Black and Hispanic population are more likely to have asthma than other U.S. residents. Puerto Ricans, in particular, have the highest rate of asthma prevalence compared to any other racial ethnic group in the U.S., according to a report. Genetics may play a role in the difference between these populations. Okay, again, genetic testing, if you are able to, try to get that done. And, just look around, ask questions around your family members, the elders, ask them. Find out about, ask about that uncle that you never knew because he passed when you were young, but you heard about him, you heard stories about him. Find out, ask questions. Mental health, about 1 in 5 U.S. adults, 51.5 million people lived with a mental illness in 2019, according to the National Institute of Mental Health. Some groups are more affected than others. About 70% of younger people in the juvenile justice system have been diagnosed with mental illness. The causes of disparity in this juvenile justice group include exposure to childhood trauma and unaddressed behavioral health issues. Mental health disparities also exist between genders. 24.5% of women have been diagnosed with mental illness versus 16.3% of men. Uninsured, underinsured, that's a given. Lack of access to health care, we know. Potential solutions. Raising awareness by healthcare providers. Yes, it starts with them. It starts with them. Advancing health equity. Social and racial economic inequities cause many examples of health disparities. Healthcare providers can engage with policymakers, urging action to help communities impacted by these factors. Now, not to be political, but the Democratic Party is more likely to focus on health care disparities. Okay, providing more resources. Racial and ethnic groups are less likely to have proper access to health resources and are typically underrepresented in the healthcare workforce. Yes. Similarly, rural and low-income communities typically have fewer healthcare professionals per capita. Okay, partnering with organizations. You can collaborate with organizations, coalitions, boards, and councils working on initiatives to address the root causes of health disparities. For example, the American Medical Association, AMA, works to diversify the physician workforce to reflect communities at racial and ethnic backgrounds. Tracking results. Monitoring and documenting a program effectiveness and health impact enables healthcare providers to tweak it up. Okay, prepare to address health equity issues. Now, these are great solutions. However, they need to be put into action. Okay, this right here, Etsy. I love Etsy. It's my new go-to to get digital stickers, whatever. So I just saw this. We have a sale. I like to, work with and partner with Black-owned stores. So Etsy is one of the places where when I buy stickers, digital stickers for my calendar, I go here and I make sure to support a lot of Black artists. My daughter is an artist as well. So if you want to decorate your desktop, etc., and to promote breast cancer awareness, here's a place that would be suitable for that. That's it for now. Again, no matter what you hear, go to the source. Do your due diligence, because you can get overloaded by information. But once you verify the information with legitimate sources, okay, not your neighbor, not your neighbor's neighbor, not your cousin's best friend, whatever, go to the source. Educate yourself by going to the source, directly to the source, to verify the information so it's not hearsay. That's all I have for today. I hope this inspires you to go get that mammogram, to go promote the women in families, go get that mammogram, and to fight health disparities. Okay? I recently lost a friend of mine. She died of breast cancer a couple of months ago. She was in her 50s, and she was well educated in breast cancer because she was a breast cancer researcher. So she knew a lot about it. And and most of my friends know someone or themselves have been affected with someone with breast cancer, if not themselves. Anyways, that's all I have today. I want to wish everyone a happy holiday. Please, please, please take care of yourself, love yourself, and those around you. Okay, till next time. This is Cynthia with the Kiddo Black Talk Show. I'll have more health and wellness coming to you, including yoga. I'm going to do a section on yoga. Yes, yoga. Okay, thank you, everyone. Please subscribe if you haven't already, and share the content. And please leave comments, leave questions, okay? If you want a video on something, just let me know. Okay, that's it for today. Talk to you later. Bye-bye.